Welcome back to Health Daily. I'm your host, Dr. J. We have a great presentation today, so let's get started. First, we'll start off like we always do with Google Trends. Let's see what's trending today. Alcohol, cancer, Surgeon General. So we click on this here, we can see a huge spike about an hour ago. What are they talking about? They're talking about the Surgeon General's call for a warning on alcohol that it can cause cancer. This will be interesting to see how it plays out because there have been back and forth conversations about a small amount of alcohol causing health benefits or giving health benefits, and other people and other professionals, other experts saying that any amount of alcohol is a poison. So comment below, tell me what you think. Which side are you on? Are you more on the small amount of alcohol can produce health benefits like red wine, or do you think all alcohol is poison? This is considered dry January for many, so we'll have a lot of alcohol talk this month. Make sure you share this video and like and subscribe to the channel. So next, let's see what's next. Next is HMPV. What is that? Human metapneumovirus, another virus that we have to worry about. But should we have to worry about it? Let's see. All right, so here we go, back to China. HMPV outbreak in China, symptoms spread, and what you should know. So this is a flu-like symptoms, flu-like illness, something that's similar to the common cold. We'll continue to watch this. It doesn't sound like anything that we should be concerned about just yet. I've been looking at some of the articles. It sounds like pretty much the same symptoms, like you can guess, cough. So that's one of the symptoms, secretion, sneezing, those things. And so let's not repeat COVID of 2019, 2020. But let's stay vigilant. Let's make sure that we watch what's happening with these. But take a look here. I want to show you how social media is a good thing, but it also can promote, worry and anxiety. Look at this social media post here. And it says, China is witnessing a surge in human metapneumovirus. In China, that's just like saying the US. I mean, where in China? Where in the US? Is it spreading rapidly? Is it spreading slowly? So it doesn't really say a lot. It just scares you, and then there's 25,000 likes. So make sure that you are aware. If you're on social media all day, make sure social media is not making you anxious, and make sure that you ask what the facts are. Are these actual facts? Next topic. This is an interesting one from neuroscience, news.com. Estrogen drives binge drinking behaviors in females. Interesting. And so this is what they found out. Long story short, the hormone estrogen increases binge drinking in females by enhancing activity in neurons within the brain's BNST region, which we will talk about. The effect is particularly strong during high estrogen phases, leading to front loading, also known as pre-gaming. I am not joking. That's what it says in the article. Or rapid alcohol consumption within the first 30 minutes of availability. All right. So let's scroll down here and actually dig into this a little bit more. So it says we know a lot less about what drives alcohol drinking and behavior in females because most studies of alcohol have been done in males, says Dr. Cleel, associate professor of pharmacology. Here, let's talk about where this BNST region is. So this stands for the bed nucleus of stria terminalis. This is also close to the region that is often referred to as a part of the extended amygdala. And as you know, or you may not know, the amygdala is also responsible, been associated with emotions, high emotional states. And this says it's a structure in the basal forebrain that plays a crucial role in integrating limbic for information and monitoring valence. So going back to this article here, peak estrogen levels associated with increased alcohol consumption. So what can we be thinking from this? Estrogen is such a powerful effect that has so many on so many behaviors, particularly in females. Let's take a look for a second at the menstrual cycle of women. Of females, and say women, they use the word female, so I'll continue to say female. So this is the cycle. All right, look at this estrogen curve. Okay, so in general, This is what happens during a menstrual cycle. For people that don't know, my men that don't know, some of the women maybe that don't know, this is what happens. Your uterus that looks like basically a balloon, right? Inside that balloon or uterus, it has this lining that is there to implant an egg, a fertilized egg. This lining sloughs off, so basically comes out. And that's what you see as your menstrual cycle. That's the blood. Those are the small little clotting looking large bloody items that come out. That's what you're seeing. You're seeing that lining come out to start a new lining, because this lining isn't. It's important for this lining to be fresh to implant a fertilized egg. Now, let's go to this estrogen phase. So this pink area right here, let's scroll down. This is ovulation, right? So we're talking about day 10 all the way to about day 17. Estrogen spikes right before ovulation. Interesting. Let's think about this for a second. It spikes right before ovulation. I know I've heard a lot of people say that they've gotten pregnant during kind of that period that they were maybe a little bit wild. Maybe they had a night of drinking with their friends, and that friend became a eternal friend with a baby, or couples. So this is interesting here. This can lead to novel approaches of decreased alcohol use and decreased binge drinking. Look at this spike. So if here, what is this, 13 of the cycle, you will possibly binge drink more commonly than, say, day 1 or day 2, when the estrogen levels are very low. So this area will be extremely important in novel treatments in the future, I think, but we'll continue to watch this and see how this plays out, and see if there's new approaches to treatment of binge drinking and just drinking alcoholism in general. Remember, this is Dry January. If you like this information, make sure you like the video, subscribe to our channel, and share this video with somebody that you know that can use this information. Last article here. Pooping. Yes, pooping before you exercise has an incredible effect on performance. Did you not know that? Most athletes know this already, right? A lot of athletes poop right before they go play. But no, quite literally, going to the toilet and emptying your bowel. If you're about to compete in a triathlon, it will make you both faster and smarter, according to two recent studies. So what did they do in these studies? They use what's called a Stroop test. And most of you have probably seen this test. You just didn't know it was called. And they also use magnesium oxide laxative. So they used a magnesium laxative basically for this person, or these people, to go to the restroom. They use 13 triathletes, and they use a Stroop test. Here's an example of Stroop test. I won't click on the video to play it, but as you can see, basically the Stroop test may display the word red, but it may appear blue in a blue text. And the participants needs to say the name of the color of the text, not what they actually see as the word of the text. And so that's how they judged whether or not they had cognitive flexibility at the time. So more poop before the race means higher cognitive flexibility and faster performance. So if you're going out for a triathlon or maybe a 10K marathon, the high rocks that we're preparing for pretty soon, need a poop, sounds like, from this study. And also, the last thing on the study, a 2022 study, which this link does work, it goes to the study, a 22 study found that patients with early stage Parkinson's disease can exhibit mild cognitive impairment when constipated. And we talked about this yesterday, as you remember, when we talked about the influence of the gut on anxiety and depression, how the gut and the brain are linked, how there's neurons in both. And those are the places in the body that contain neurons in the gut and the spinal column, brain. Those are all linked. And so this is not far-fetched, and it makes a lot of sense that mild cognitive impairment would happen if someone's constipated. And I bet you it's not just Parkinson's. We just probably haven't been able to measure it in the normal population. The last thing I want to say, this is the first weekend of the new year. You're going into the new year. like I said, this is dry January. You have to decide, are you going to continue dry, or are you going to drink less? Remember, if you have a goal in mind, this is the weekend to make sure you challenge yourself to keep that goal going. There may be people around you that don't believe in you. Maybe they don't trust that you're good enough. You are. You are good enough and you can do it. Whatever your goal is, if you've started already on your weight loss journey, your weight gain journey, just your wellness journey, continue through this weekend. It's only 2 days. Pick activities, stick to those activities, pick your plan, stick to your plan. If you're starting on Monday, make sure on Sunday you don't over drink, you don't binge drink. For my ladies, use some of this information. Maybe this is still preclinical information, but maybe they're onto something. If you are about to hit ovulation, maybe you should slide the drinks to the side. You have to decide that for yourself. This is not medical advice. You have to decide. You're the only one that feels the pain when you're at home. You're the only one that gains the weight. You're the only one that loses the weight. Until tomorrow, we will talk tomorrow. As always, I'm Dr. J. This is Health Daily. Thank you for joining.